right? So we're going to set everything up as far as workflow while the patient's in the lobby before they even come back. So let's go take a look at the software real quick first, and then I'll show you how it's set up. I changed it a little bit, okay? Now I'm used to, instead of changing how you guys do things here, show me how you access the Pano X-ray at this point. How do you guys do it off the schedule?
Go for it, Triple.
Don't make
Because I don't want to
mistake.
change how you do it.
The pendulum.
Okay,
And then,
great.
yeah.
Now, I changed it. It's going to be a different icon there
Okay.
because I'm going to twain in another software which will make the image quality better. Okay, so yes, you hit acquire here. You're going to see this instead of what you normally see, and then you're going to get the green light like you normally would, right? Just, I want you to see this other screen behind it. It's just another layer there. Okay, so now it's green light. Green light means good, right?
Okay.
So green light, let's go to the machine. Now again, at this point, the patient's still in the lobby. Because what would the patient would like best is come in, take the x-ray, instead of having to stand there and wait, right? So get it all set up and then go to the operatory. So the workflow is very smooth. Okay, so patient's still in the lobby. You touch the screen now, it won't go up and down. It's like, some people think it's broken, but it's not. So you have to touch the screen, okay, to wake it up. Remember that, because if you don't touch the screen and you're going to go, oh, something's wrong, call Mara, call tech support, then it's a waste of time. Just touch the screen, wake it up. Okay? Now we're going to focus on 2D first. Okay, this is 2D Pano. All right, so let's look at the programs here on your other Pano, P1. Remember, it's the same program. So P1 is Everyday Pano, and it shows TMJ to TMJ. So this is your Everyday Pano. To change the programs, you use these arrows. The other one, you use the arrow up and down here, right? This is the same thing as that. So right arrow, and it just keeps going. So P1, Everyday Pano. However, if you have a patient with a lot of metallics in the mouth, ortho, bridges, fixed bridges, things like that, anything metallic you can't get out. Normally you would get a Pano with a lot of scatter. Remember all that white streaking across? If you want to avoid that, if you notice full mouth restorations in an arch, touch the P1.
Okay.
The P1 will turn into P1A. P1A stands for artifact free. Okay? So that's going to take a slightly different angle, so the scatter is going to be reduced substantially.
You know, when patient has a lot of breaches, crown,
Braces.
the person is
Moderate,
okay. Yeah.
PFMs, things like that. It's going to
Dentures, if you like to take the pain on the dentures.
Yeah.
Should we practice on one of our patients? She's
Yeah.
yeah, we have a
We
profi,
could.
so we can do
So
it.
let's do this. Do you want to go ahead and just watch how I position? Okay, let's do that. Let's get the patient ready on the schedule first on the computer, and then we'll go through everything. I'm going to show you something a little different. I'm going to use an automatic patient positioner for you guys. Because the biggest problem is the angulation, right?
Right.
It's a kid though. It's a
Okay.
kid. Yeah.
Okay.
Yeah, for you, yeah.
So let me ask you this. We have a pedo shot just shows the dentition, or do you want the whole
Just a few.
TM?
Just a
the
few.
pedo?
The patient has
So
done
it
already.
used to be
It's only
P10,
2,000
right?
elements, okay, we just-
P10.
P10.
Correct.
It's still P10.
One, oh, it's just the same thing, the P10? Okay, all right.
Okay, so I don't have gloves. Do you want to put the barrier on?
And do you want to tell us what's the difference CT scan and the one
No,
that
no,
you
they-
see
Yeah,
later?
I'm going to show you
Okay.
everything.
Okay.
Yeah, I'm very methodical. I'm sorry. I just
Okay,
go-
no,
Yeah, I just want to go
that's
2D so it's not confusing, and then the 3D. Okay, so
So
that goes.
actually, this machine will auto detect the size of the patients, or I just heard you guys say auto detect.
Auto patient positioner.
Oh,
angulation.
auto pay. Okay. You still have to go in there to choose how
The
big.
patient size, correct. So how
Okay.
old is this patient?
I don't know.
7 maybe?
Okay.
7, so we're just gonna keep it here.
Yes.
Okay. So let's put that on the tab. See that what you're holding on to goes in here. Turn it around. Okay, then hold this in there.
没有，那是 video。
So that's it, right there.
That's it. Now, I'll show you here the difference. When the patient bites here, usually with the anteriors, you'll notice what happened in the past, where the anteriors are very crowded, you can't see things.
Right.
That's very common. What happens with the anteriors getting very crowded is because the patient goes over here and the standard bite stick that you're accustomed to, you're used to this one, correct? The sharp for pedo? Oh, you use the other one?
You use the other one.
Okay.
No, actually, I think our machine, the Chic, it doesn't come with that one.
Oh.
That's a 2007 or something like that.
Okay.
Yeah.
So you had the little tab. Okay. That one still had the groove in it, right?
Right.
That groove is your focal spot. It's the sharp image layer. What happens with a lot of people, a lot of patients just come over and go over that groove. When you go, right? If you go over the groove, everything is out of focus. Your anterior is just blurry, it's crowded, and if you get that, you know the anterior teeth weren't in this groove. Okay? So you have to have it in this groove. If it's not in there, it's not focused, okay? I'm using something called the auto patient positioner. It has a groove that's already set, it's very hard to miss. Okay, so we're looking for consistency. This will make it consistent for you. Okay, so look at the arch right here. Patient will already know where to bite. Okay? So let's try this. Also what this does is, remember the Frankfurt horizontal plane? We have lines here and the light here. Where on the face, let me ask you this, where on the face would you do the midline, line up in the middle? Where would you look?
Here and here.
Okay. Good. You're partially right there, and I'll show you that. Noses are crooked. Right? So those aren't straight.
Yeah, 小朋友 nose is crooked, yes.
Filipino people, where are you going to put in the middle? Right? You don't know. So between the eyes. Okay?
Okay.
8 and 9 are crooked. Tom Cruise. His is off, right? So this is always in the middle. If this isn't in the middle, they have to go to a different doctor first, right? Take care of that. But it's here, always in the middle. So the midline, right between the eyes. The Frankfurt horizontal, without the patient positioner, I'll show you this, is the inferior orbital ridge. Right here, this bone, this eye socket right here, the inferior orbital, to the top of the auditory canal, the ear hole. Right? So that's where you want it. So that's where the angulation. If you get a severe smile, big smile, chin's 2 down, right? If you get something flat or upside down, a frown, chin's too high. This will make it consistent. It's up and down, and I'll show you how this works. Take a look at this. It's very important. Take a look at the machine whenever you use this. Okay, this is only good for standard everyday panel P1 and P10. Okay, that's it. P1 and P10, but that's your everyday panel, right? Now notice, see that? It has an arrow here, green arrow.
Awesome.
Okay, so let's pretend you're the patient. Hold it there. Pretend you're the patient. Try not to move your hand up and down, okay? Just notice it says green arrow down. Watch your head. I'm going to move this down, okay? Little at a time. Don't go crazy. Don't move your hand. Try to keep your hand steady, okay? Keep your hand steady, like a patient's biting. I haven't let go. Done. That's the right angle.
Beautiful.
It stops automatically. Okay, but you have to watch the patient, make sure it doesn't go too fast and past that point.
So the machine actually will stop
It
right
will
at
stop.
okay.
Now let's make it low. Make it low, so I have to move it, or make it high, I'm sorry. Let's make it high, so I'll move the opposite way. Again, go a little at a time, okay? Because it speeds up. You know how the machine speeds up? Go a little at a time, a little at a time. The angulation's right.
Okay.
That's done.
There's
okay.
no excuse now.
Now, after you get the angulation right, do the temple supports. Now this is pressure sensitive, so it will stop automatically. A lot of people are scared to use this, period. The
You
thing
guys use
is,
it? Okay.
if you don't use it, patient will move. And anytime the patient moves, the image quality suffers. So temple support, then forehead support. Okay, but this one, don't hold it till it stops. That's a little pressure and may move the patient back a little bit.
Okay.
So when that makes contact, go ahead, let go. Okay. Last thing is, have the patient move their feet forward, shuffle their feet forward till they hit your foot. You want them leaning a little bit. Do you remember why? Somebody tell me why. Smile a little bit, but why is that
Spine.
important?
Uh,
The spine. You ever get a pano where it's white in the middle? You can't see the anteriors. It's because the patient's standing straight up, neck is compressed. By having your feet forward just a little bit and you're leaning a little bit, opens up the spinal column and it can go through to the sensory. That's why it's important to understand that. Okay? So we'll wait for the patient.
Oh, patient's ready though. Just go ahead and.
Oh yeah, is
just
a
go ahead.
patient?
Yeah.
No. That's the only patient that I have. You know, when during the training because we already booked that patient. That's why it's a kid really quick. So
Okay.
yeah, so just bring the kid in.
Yeah,
No, not
it's-
that one. No. She is done. I did a crown for her, so she's done.
Okay.
Yeah.
Okay. No,
Oh,
the computer's ready.
That's the one. Is that
Okay.
is that under?
Yeah, good.
Okay, good. Very
Okay.
good. Good. Oh, okay. So this is a lot more advanced than
Oh, yeah.
the Chic, even the, and I know that this one can do the biting too, right? Is it? Okay.
I'll
Is it?
go over that.
Yeah. You don't wanna, not
I s-
rig.
I'll talk about the bite wing. The bite wing is great for backup. I still think the sensors are still better
Mm-hmm. Yeah,
image
it
quality.
should be, right? It should
But
be. Yeah.
sometimes if you can't get the posterior, this is a great alternative.
Yeah, backup, I mean, it's just like another options.
Correct. Yeah. Then I'll spend more time on the 3D than the rest of the time with you.
Mm-hmm.
Yeah.
Yeah, they mainly just kind of go over how the panel taking. We've been
Yeah,
taking panel for a
I'll
while.
go over it and make sure they understand.